Good evening, that's me, 1 week after my PTE surgery. So good evening, and thank you for letting me come here and tell my CTEPH story. My name is Pam Kehoe, and I live in a small community midway between Milwaukee and Chicago in Wisconsin. Please forgive me if I forget words or make mistakes. I call that my brain freeze. 6 months ago, my body was cooled to 60 degrees and my head to 40 degrees. My blood was drained to create a bloodless field. I underwent an 8-hour pulmonary thromboidectomy, and I think I said that wrong, but PTE surgery, to remove accumulated blood clots from my lungs at the University of California in San Diego. Looking back, my first incident might have been about 20 years ago after a long flight. My left leg massively swelled up and was hot to touch. This was most likely a DVT that went untreated. Through the years, I've flown or driven many long distances, each time arriving with a dry, hacking cough and shortness of breath. I've led a somewhat sedentary lifestyle, and my favorite pastime is being curled up with a good book. In August of 2013, I fell and got a concussion, a broken nose, and multiple contusions. I was flat on my back for 2 weeks with vertigo. In October, I traveled to and from Florida. The humidity there had me wheezing and short of breath, and as I told Joe, I couldn't get through 1/3 of a line dance song. Then on December 9th, after shoveling a driveway, cleaning and doing laundry, I could still function physically. But when I climbed the stairs late that afternoon with a basket of laundry, I was literally bumping it up one step at a time. I just couldn't breathe and felt like I was passing out. Off to the ER I went. I was admitted to the hospital that night for a week. A CT showed blood clots on my lungs. My family physician said they rarely repeat scans and that those blood clots would be reabsorbed by my body. The cardiologist that saw me in the hospital agreed, but then left his practice. So I saw a new cardiologist at a 3-month follow-up and then again at 6 months. And I kept wondering, do they really reabsorb? So I kept repeating, could we just do that test again? That cardiologist repeated this CAT scan, which showed more blood clots. I started using a CPAP machine, and I continued on anticoagulants. I did not feel any better. In fact, I felt worse. I gave up. I wrote the story of my life for my daughters and wrote my obituary. We shared old family pictures with my sister-in-law, who's a home health nurse, and I had not felt well for a few years, so I was the one that hosted the family parties. And finally, we got to see her. She had no idea all this was going on with me. Dan went for dinner and carry-out, because I wasn't cooking, and she wanted to review my medical records and see what she could see. And she compared the 2 CAT scan reports and told me that I couldn't give up. She immediately helped me get into the right doctor. Even before she saw me, Dr. Zawicki of St. Luke's in Milwaukee ordered an echo, bubble study, pulmonary function test, a VQ scan, and a pulmonary angiogram. I'll never forget the way she introduced herself. She walked into the office and said, "Hi, my name is Diane Zawicki, and you're going to California for surgery." The long process of a proper diagnosis took my family physician, several PAs, 3 cardiologists, a pulmonologist, a psychologist, and numerous underdiagnosed visits to clinics. Along the way, I had accumulated the laundry list of diagnoses of an 80-year-old, which included pulmonary embolisms and infarctions, obstructive sleep apnea, asthma, obesity, anxiety, insomnia, COPD, recurrent bronchitis, pneumonia, postmenopausal menopausal depression, and pulmonary arterial hypertension. A greenfield filter was installed and the long process to be chosen to have PTE surgery began. After an unbearable wait, February of 2015, my husband and I traveled to California to repeat all the pre-op testing and finally hear that I was a viable candidate for PTE. On February 23rd of 2015, I underwent this life-saving surgery. Now, 6.5 months after my surgery, a chest x-ray shows that my left lung is still healing. The echo came back normal. All right-sided heart enlargement is gone. And an overnight oximeter test just verified that my oxygen levels are consistently above 90%. I am no longer on oxygen. I remain on anticoagulants and will for the rest of my life. My supportive husband, Dan, now says, "You can't use that brain freeze excuse forever." God's got a plan. He's not done with me just yet. A fellow CTEPHer reminded me this disease does not discriminate. Young and otherwise healthy male and females are candidates for the possibility of CTEPH. And this might be redundant, but RN Kelly Johnson, Miss Colorado, just shared. Nurses are the ones who make the most direct contact with the patient. They're the advocates, the planners, and the glue that holds it all together. So please look at the whole patient and the possibility of CTEPH when fat old ladies who can't breathe present themselves. Thank you for listening, and if you care to come and visit me at the CTEPH booth, I would love to talk to you tomorrow, anytime. Thank you.
That was very moving. And now dinner will be served.